Danger. Signs indicating that you may have cancer. Hello, and welcome to our channel. Today, we're tackling a topic of utmost importance: 8 warning signs of cancer you should not ignore. It's a subject that affects us all, directly or indirectly, and it's crucial to be informed. Cancer is a relentless adversary that can strike when we least expect it. Whether it's you, a family member, or a friend, being aware of the warning signs is the first line of defense. Cancer doesn't discriminate, and early detection can be life-saving. In today's video, we're going to explore 8 key warning signs that can indicate the presence of cancer. These symptoms often go unnoticed or are dismissed as something less serious. By understanding and recognizing these indicators, you could potentially save a life, maybe even your own. So, what are these warning signs, and how can you distinguish them from common, less concerning ailments? Stick around, and we'll provide you with valuable insights. Throughout this video, we'll discuss each warning sign in detail, offering information, statistics, and practical advice on what to do if you notice any of these symptoms. By the end, you'll be well-equipped to make informed decisions about your health and those you care about. So, let's dive right in. 1. Persistent cough or hoarseness. A persistent cough or hoarseness is a symptom that can potentially signal an underlying health issue, including the possibility of cancer. This symptom refers to a cough that lingers for an extended period, often weeks or even months, without showing signs of improvement. Hoarseness, on the other hand, pertains to a noticeable change in the pitch or quality of the voice, resulting in a rough or raspy sound. While a persistent cough or hoarseness can be indicative of lung cancer, it's essential to recognize that these symptoms can also be associated with various other types of cancer. For example, cancers affecting the throat, larynx, or esophagus can lead to persistent hoarseness. Additionally, cancers in the lung or nearby structures can trigger a chronic cough. It's important to understand that a persistent cough or hoarseness is not solely a result of cancer. Other non-cancerous factors, such as respiratory infections, allergies, or irritants like smoking, can also contribute to these symptoms. Due to the potential seriousness of these symptoms, especially if they persist over an extended period, seeking medical attention is crucial. A healthcare provider, which may include a primary care physician, pulmonologist, or an ear, nose, and throat specialist, can perform a comprehensive evaluation. 2. Abdominal pain or discomfort. Abdominal pain or discomfort refers to a sensation of unease or pain in the region between the chest and the pelvis, commonly known as the abdomen. It is a symptom that can potentially signify by various types of cancer, and early recognition is crucial for timely medical intervention. One of the cancer types commonly associated with abdominal pain is ovarian cancer. Ovarian cancer may cause vague, persistent discomfort or pain in the lower abdomen, often accompanied by bloating. This pain may vary in intensity and could be sporadic or constant. The discomfort is typically experienced deep within the pelvis. Pancreatic cancer is another type of cancer that can manifest with abdominal pain. The pain associated with pancreatic cancer is often described as a deep, gnawing discomfort, typically radiating to the back. It can be persistent and unrelenting, and it may become more noticeable as the cancer advances. It's important to acknowledge that abdominal pain or discomfort is a symptom that can result from non-cancerous conditions as well. These may include gastrointestinal issues, such as irritable bowel syndrome, IBS, gastritis, or gallbladder problems, and may also be linked to dietary factors, food intolerances, or infections. 3. Changes in bowel or bladder habits. Changes in bowel or bladder habits refers to alterations in the regular patterns of bowel movements or urination that deviate from an individual's typical routine. These changes can potentially indicate an underlying health issue, including the possibility of cancer. Specifically, with respect to bowel habits, noticeable changes may include persistent constipation, which refers to infrequent or difficult bowel movements, or alternatively, persistent diarrhea, characterized by frequent, loose stools. Additionally, the presence of blood in the stool, either visibly or detected through specialized tests, can be an alarming sign. These changes can be indicative of gastrointestinal issues, including colorectal cancer. In terms of bladder habits, changes may encompass alterations in urinary frequency, where a person may need to urinate more or less frequently than usual. Changes in the color or appearance of urine, such as blood in the urine, hematuria, or a cloudy appearance, can also be significant indicators. These alterations may suggest potential issues related to the urinary tract, including bladder cancer. It is important to emphasize that changes in bowel or bladder habits are not exclusive indicators of cancer. Other non-cancerous factors, such as dietary changes, infections, medications, or hormonal fluctuations, can also influence these patterns. Given the potential gravity of these changes, especially if they persist over an extended period, seeking medical attention is paramount. 4. Unexplained weight loss. Unexplained weight loss is a significant and often concerning symptom that may indicate an underlying health issue, potentially including cancer. This phenomenon refers to a noticeable decrease in body weight without any intentional changes in diet or exercise habits. It is typically considered significant if a person loses more than 5% of their body weight within a span of 6 to 12 months, without a clear explanation. Cancer-related weight loss occurs due to the increased metabolic demands of malignant cells. Cancer cells tend to grow and divide rapidly, consuming a substantial amount of the body's energy resources. This heightened metabolic activity can lead to a decrease in body weight, as the body struggles to keep up with the energy demands. Certain types of cancer are more commonly associated with unexplained weight loss. For instance, cancers like pancreatic, stomach, lung, and esophageal cancers are notorious for causing substantial weight loss in affected individuals. This weight loss often occurs even before other symptoms of cancer become apparent. It is crucial to note that while unexplained weight loss can be a potential indicator of cancer, there are also various non-cancerous conditions that can lead to a similar phenomenon. These may include thyroid disorders, diabetes, gastrointestinal disorders, and chronic infections, among others. 5. Changes in skin. Changes in the skin's appearance can serve as significant indicators of potential underlying health issues, including the possibility of cancer. This encompasses various alterations, such as the emergence of new moles or shifts in the characteristics of existing ones. These changes may involve shifts in color, size, shape, or texture. One of the most critical concerns related to changes in the skin is their potential connection to skin cancer. Skin cancer, including melanoma, basal cell carcinoma, and squamous cell carcinoma, often manifests with noticeable alterations in the skin. This can encompass a range of changes, from shifts in pigmentation to irregularities in the border or texture of a mole. When it comes to skin cancer, early detection is paramount. Identifying and addressing skin changes promptly can lead to significantly better treatment outcomes. Regular self-examinations and seeking professional medical evaluation for any suspicious skin changes are key steps in this process. 6. Difficulty swallowing. Difficulty swallowing, medically known as dysphagia, is a concerning symptom that can potentially signal an underlying health issue, including the possibility of cancer. This symptom refers to a noticeable and persistent challenge or discomfort when trying to swallow food or liquids. While difficulty swallowing can indeed be an indication of throat or esophageal cancer, it's important to understand that other types of cancer can also lead to this symptom. For instance, cancers in neighboring areas or those that exert pressure on the esophagus can also cause difficulty in swallowing. The causes of difficulty swallowing are varied. In cases of cancer, a tumor may narrow or obstruct the esophagus, making it difficult for food and liquids to pass through. Additionally, inflammation, or irritation caused by the cancer can contribute to this discomfort. It's important to note that difficulty swallowing can also result from non-cancerous conditions. These may include neurological disorders, esophageal strictures, or even certain medications. 7. Fatigue. Fatigue is a pervasive and often debilitating symptom that can be an indication of an underlying health issue, including the possibility of cancer. It refers to an overwhelming and persistent sense of tiredness or lack of energy that goes beyond the usual weariness one might experience after exertion. Unlike normal tiredness, which can be relieved with rest or sleep, cancer-related fatigue tends to persist and may not improve even with ample restorative measures. The mechanisms behind cancer-related fatigue are complex and multifaceted. One contributing factor is the body's response to the presence of cancer cells. The immune system's efforts to combat the disease, coupled with the metabolic demands of rapidly dividing cancer cells, can lead to an overall sense of weakness and exhaustion. Various types of cancer can be associated with fatigue, with some cancers like leukemia being particularly notorious for causing profound and persistent tiredness. Additionally, cancers that have metastasized, spread to other parts of the body, or cancers that affect critical organs can exacerbate fatigue due to their systemic impact. It is important to note that while fatigue can be a potential indicator of cancer, there are numerous non-cancerous conditions and lifestyle factors that can also lead to persistent fatigue. These may include chronic illnesses, certain medications, poor sleep quality, stress, and nutritional deficiencies. Given the potential seriousness of fatigue as a symptom, especially if it is prolonged and significantly impacts daily functioning, seeking medical attention is crucial. A healthcare provider can conduct a comprehensive assessment, which may include a detailed medical history, physical examination, blood tests, and potentially imaging studies or biopsies. 8. Unusual swelling or lump. Unusual swelling or lump refers to the presence of an abnormal enlargement or mass in a specific area of the body that is not typically observed. This can be a significant indicator of an underlying health issue, potentially including cancer. These swellings or lumps may vary in size, texture, and location depending on the type and stage of cancer. They can be painless or accompanied by discomfort, and they may or may not be visible on the surface of the skin. In the context of cancer, unusual swellings or lumps can arise from the growth of abnormal cells. These cells can form a mass or tumor, which may be benign, non-cancerous, or malignant, cancerous. Malignant tumors have the potential to spread to nearby tissues or other parts of the body, a process known as metastasis. It's important to note that unusual swellings or lumps can also result from non-cancerous conditions such as cysts, lipomas, or infections. These benign growths can also cause noticeable bumps or enlargements. Above are 8 crucial signs of cancer that should never be overlooked. If you're facing any of these symptoms, seeking prompt medical attention is crucial. Early detection is the cornerstone of successful cancer treatment. By remaining vigilant and acknowledging these signs, you stand a far better chance of catching it early and increasing your odds of survival. It's important to note that waiting for symptoms to exacerbate is not recommended. If you have any concerns, do not hesitate to consult a doctor promptly. Should you find these insights beneficial, I invite you to express your endorsement by engaging with this content, liking, subscribing to my channel, and activating notifications for a steady stream of the latest health and nutrition wisdom. Your support fuels the dissemination of valuable knowledge.